Welcome everyone to another BBB webinar. For those that do not know me, my name is Pamela Anson and I am the Director of Brand Outreach here for Better Business Bureau serving Greater Cleveland. And I want to thank you all for joining us today, and a special thanks to our BBB accredited businesses who signed on. And before we get started, just a few housekeeping things. This webinar will be recorded, so you will be able to watch it later, share with anyone that you might know, maybe some staff, and it will also be on our BBB YouTube page for you to view at another time. If you have any questions throughout this webinar, please feel free to type those in the questions box. We will do our best to get those answered at the end of the presentation. And today I am very excited to welcome Brandon Smith with us today. He has actually done presentations before and we have had great feedback. And Brandon is the Public Affairs Specialist for the Social Security Administration. He's a Cleveland native and he's been with the Social Security Office since 2003. He was a teacher for 3 years with the Diocese of Cleveland, and he started his government work as a claims representative, specializing in retirement, survivors, disabilities, and health insurance. And in 2007, he became the Public Affairs Specialist, which he does outreach and presentations throughout Cuyahoga Lake and Lorain and Geauga counties. We are so excited to have you here, Brandon, and I will pull up the webinar and pass the torch to you.
Thank you so much, Pam. I greatly appreciate it. The funny thing is, when you said I've been with Social Security since 2003, initially in my brain I said, no, it can't be that long. I'm still young. You know, I know how to do the Macarena, and I know how to log into MySpace. But then I did the math, and yeah, it's been 19 years. So been with the agency 19 years. Been a public affairs specialist for 15. Wow, 2003 is a while ago. It's a different world. So, ladies and gentlemen, thank you so much for joining us, and I want to thank Pam especially for setting this up, and she's the pilot today regarding the slides. So, this afternoon we're just going to go over the basics of Social Security, retirement, survivor, spousal. We'll touch briefly on Medicare as well. What I usually tell people is, in situations like this, please understand that number one, it's general. By no means this is going to address every single solitary situation that may come up regarding your particular benefits. Number two, all of the dollar amounts are specific to this year. Usually in October or so, we get the numbers for the next calendar year. So, I'd say, definitely before Halloween, the 2023 numbers should be released regarding Social Security. The third thing I want to say is, please do not construe this as advice. By no means am I going to tell you what you should do, what path you should take regarding your Social Security. Ultimately, we want to give you some information that will allow you to make the most informed decision for yourself. The last two things I want to say real quick. Number one, all of our benefits are gender neutral. There is no husband benefit. There is no wife benefit. There's benefits payable to you as an individual, your spouse, ex-spouse, children, surviving spouse in the event of your passing. So please sort of divorce yourself of the concept of gender regarding benefit eligibility. And the final thing is, speaking of family members, if we pay your ex-spouse, ex-spouses, child or children, whatever we're paying them is not coming out of your check. You will not receive less money because of the eligibility of a family member or a former family member. So with that, sit back, relax. If you walk away knowing 3 things that you otherwise don't know now, great. If you know 2 or less, you may not have been able to stay awake. If you know 4 or more facts, then you're throwing off my curve. So please stop it. So with that, Pam, let's get the show on the road. So about 10 years ago, we stopped sending out the annual Social Security statement. It was a green and white form that you get a couple of months before your birthday. We resumed sending out the statement, but only for people that are 60 and older. So if you're on this call and you're 59 or younger, you're not getting an annual Social Security statement mailed to you. So what can you do? You can create, free of charge, which is my favorite cost, a My Social Security account at socialsecurity.gov/myaccount. If you're not on Social Security, it lets you do a lot of cool things. Well, I guess cool is in the eye of the beholder. And if you're already receiving benefits, it lets you do some other things. Next slide, please. For someone that is not receiving Social Security benefits yet, the My Social Security account lets you request a replacement Social Security card. It gives you the option of checking your statement. So it'll give you a breakdown of the wages that you made paid in both Social Security and Medicare. Now, here's the thing. Your earnings information on our end is probably correct, but mistakes do happen. Somebody transposes a couple of numbers. Maybe you worked multiple jobs and not everything posted correctly for 1 year. Maybe I thought that I worked for Pam, but she thought that I was a independent contractor. She gave me a 1099. I didn't know what to do with it, so I didn't do anything with it. I didn't pay taxes. So stuff does happen. Why not take a couple of minutes every year, every 2 years, every 5 years, just to give your statement a cursory glance to make sure it looks right? You can check your benefits. If you want to get retirement benefits, disability benefits, you can see how much your loved ones would get in the event of your untimely passing as well. Next slide. If you're already receiving Social Security benefits, you can change the address, telephone number, direct deposit of your benefits online. You can use this My Social Security account to request a 1099 for tax purposes. Well, Brandon, tax time is over. Not if you filed an extension. So you might still need that 1099 to file your taxes. If you're on Medicare and need to request a replacement Medicare card, that can be done via the My Social Security portal. If you're receiving one of our disability benefits and you're working and you need to report those wages, that can be done via the My Social Security account. Maybe I'm shopping for a new car or an apartment and I need to have proof of my Social Security earnings. You can get that benefit verification letter via the My Social Security portal. And once again, free of charge. In some instances, you can request a replacement Social Security card. socialsecurity.gov/my account. Next slide, please. To be eligible for Social Security retirement benefits, there is a work and an age requirement. You can't have one without the other. This is the sourdough starter of benefit eligibility. I've used that line before. To be eligible for benefits, you got to be at least 62 years old. Every month that you are willing and able to wait past 62, the check would increase. So if you're 62 and 9 months old, that check is larger than it would have been at 62 and 2 months. Every month makes a difference. As far as your, as far as your work is concerned, you need to have worked and paid into Social Security for at least 10 years on a part-time basis. Those 10 years do not have to be consecutive. Over the course of 10 years of work, you would earn something called 40 credits. You can earn up to 4 credits per year this year in 2022, which is still weird to say. I was thinking we would have flying cars by now. I'm looking out the window. I don't see anything in the sky. A credit of coverage is $1,510. This year, 4 credits is $6,040. So think back throughout the course of your working career. Do you have at least 10 years of earning 4, 5, or 6 grand? If you do, you easily have the 40 credits that you would need for benefit eligibility. Next slide. While 62 is the earliest point in which you can collect benefits, all of us have something called a full retirement age. The full retirement age is the point in your life in which, one, you'd be eligible for the full unreduced check if you were willing and able to wait until that point in your life. It's also the age in which you can work and earn whatever you want to and collect benefits. There's no earnings limit upon you as of your full retirement age. It used to be 65 across the board until the 1983 Social Security amendments. Those amendments stretched it out to what you see in front of you. So it could be 66 years old if you were born between 1943 and 1954. It could be 67 if you were born in the 60s or later. I was born during the Ford administration, even though I know I look very youthful. So my full retirement age is 67. This chart does a good job of at least showing you what the percentage reduction would be if you take the check at 62 versus your full retirement age. That's the trade-off. Do you want a smaller check sooner? You'll get more checks overall, but you will be locked into a lower rate. Versus, do you want to wait until you're older? You'll get more money per check, but you're going to get fewer checks overall. You got to play your mortality into the equation. You have to think about, your health, how long did your parents live, your financial situation. I'm gonna make a number of jokes and quips, and if you just sort of nod at my pathetic nature of humor, that's great. But this is, in all seriousness, there is no one size fits all when it comes to Social Security benefits. Everybody's individual situation is going to be different. You can't sit there and say, well, my cousin, my friend, my brother said, their life situation is going to be different than yours. Off my soapbox. Next slide, please. Let's pretend all of us were born between 1943 and 1954. That would mean our full retirement age is 66. In this example, at 66, this person would be getting $1,000. Well, you can see how the benefit grows as they age. $750 at 62, $800 at 63, $866 at 64, so forth and so on. Now, Brandon, you said this person's full retirement age is 66. Why do I see continued benefit growth after that? Because the way Social Security retirement checks work is if you are willing and able, you're going to hear me say that a couple times, if you're able and willing to wait past your full retirement age, the check can continue to grow as long as you wait until you turn 70. 70 is when you're eligible for the largest age-based retirement check. The check grows at a rate of about 2/3, 1% per month. So those $80 increases you'll see, that's the yearly increase this person would get by waiting. So for this person at 70, their check is 32% more than it would have been at 66. Well, what happens if they take it after 62 but before 63? Remember, every month makes a difference, but that would be a really unwieldy looking chart if we did every single solitary monthly increase from 62 to 70. So we just sort of stuck to the birthday months. Next slide, please. All right. So you're old enough, you've worked long enough, you decide it's time. You go apply for your benefits. Certain family members are potentially eligible because you're on Social Security. The first person we may potentially be able to pay is your spouse. Spouse is the person that you are still currently married to. For your spouse to be eligible on your work record, you have to be married for at least 1 year. Second, your spouse who is applying on your record needs to be at least 62 years old, unless you guys have children that are under the age of 16 or children that are disabled before turning 22. Finally, we cannot pay your spouse benefits based on your work record until you, as the wage earner, apply for your own benefits. How much can a person receive as a spouse? The most your spouse could potentially receive is 50% of your full retirement age amount. But to be eligible for that full 50%, your spouse would also have to be at their full retirement age. Well, Brandon, my spouse is eligible for their own Social Security benefit. Is that going to play a part in how much they're going to get from my record? Absolutely. If your spouse is eligible for benefits on their record, that's going to impact how much additional they might be able to get on your record. And if what we can pay them on their own record exceeds what they can collect on your record, they won't be eligible for spousal benefits. Example, let's say I'm eligible for $500 in spousal benefits, but my own record is paying me $700. Well, since I'm already collecting more money in retirement benefits than I could receive as a spouse, there's nothing to pay me as a spouse. Next slide, please. Let's say you were previously married, and in this situation, you're now divorced, and everyone, regardless of how you feel, is still alive. A person can potentially be eligible for benefits on the record of their living ex-spouse. You would both have to be at least 62 unless the wage earner is already on disability, receiving disability benefits. You have to have been married for 10 consecutive years. And the ex-spouse that is applying for benefits would have to be unmarried. You cannot have a husband or wife and sign up for benefits on the record of a living ex-spouse. The burden of proof is on you as the applicant. So if you want to apply for benefits on the record of your living ex-spouse, we need you to provide us with your Social Security number, their Social Security number, the marriage certificate, and the divorce decree that clearly indicates you guys were married for 10 consecutive years. There is an advantage that you do have as an ex-spouse. You don't have to wait for your ex-husband or ex-wife to sign up for benefits to potentially be eligible on their record, as long as you meet all the criteria based on age, length of marriage, and you guys have been divorced for at least 2 years. Last thing, sometimes people will say, hey, I was married a couple times. Can I get a couple of checks? The answer is no. So let's say you're married 3 times. The first marriage, 10 years. The second one, 12. The last one, 15. You've been busy, but we can pay you off of any of those records, assuming you meet all the criteria for eligibility, but we can't pay you simultaneously off of 3 different records. Next slide, please. It's a little simpler when you got your kids. So children, of course, son, daughter, gender, non-issue. Biological, adopted, step, even grandchildren under certain circumstances. Your children might be able to qualify if you are receiving retirement benefits, disability benefits, or have unfortunately passed away. The children, however, need to be under the age of 18, 19, but still a full-time student in high school, not college. Or the children can be of any age as long as they were disabled before they turned 22. And in most instances, the children have to be unmarried. Next slide, please. I am blessed to have this position to where I'm able to communicate with the public, and I've, like we said at the beginning, I've been doing this particular position for a decade and a half, and over that time I've done hundreds of events, talked to thousands of people, and there's this overarching belief that there's something magical about the last 3 or the high 5 or the high 10 years that you had worked. None of that is true. Your benefit amount is based on the monthly average of your highest 35 years of work paid into the system. Not the last 3, not the high 5, not the high 10, the highest 3.5 decades worth of work. Well, Brandon, I've only got 20 years of work. What happens with me? Then we're going to use 15 years of zeros. That's a pregnant pause for a dramatic effect. You need to have 10 years of work paid into the system to be eligible for benefits. But when it comes to calculating, in honor of our former quarterback, Johnny Manziel, when it comes to calculating how much that check's going to be, it's going to be based on the highest 35 years of work. Please do not feel that Social Security is demanding or wanting you to work for 35 years. Work as long as you want to, have to, feel up to it. But just understand that, of course, if we're looking at everything in a vacuum, so if it's a situation of, hey, I've got 35 years of work making 80,000 versus I've got 15 years of work making 80,000. The more years you have, the better your check, the larger your check amount would be. But obviously, work as long as you need to, want to, or can. Don't let our rules, sort of dictate how long you want to stay in the workforce. Next slide, please. One of our free online tools is called the Estimator. You can find it at our website, socialsecurity.gov/estimator. It differs from the My Social Security account because with My Social Security, it's giving you a copy of your earnings information. The Estimator doesn't do that. It sort of assumes that whatever information we have is correct, and it gives you a quick estimate of benefits. You do need to put in 5 bits of information: your name, Social Security number, date of birth, state of birth, and mom's maiden name. And assuming that information matches what's in our records, the estimator can give you an estimate of benefits. You got to have your 40 credits or 10 years of work paid in for it to work. It also won't work for you if you're already receiving Social Security benefits or have applied for benefits, or if you are going to be eligible to receive benefits from a job in which you didn't pay into Social Security. The estimator won't give you an accurate amount in those instances. But assuming your work has always been under Social Security covered employment and you got your 40 credits, it might be a useful tool for you to use. Next slide, please. You got 3 ways to contact us. please choose the option that works best for you. And I'm multitasking because I want to make sure I have the right hours for all of this. So online, over the phone, or in person are the three different ways that you can apply for Social Security benefits. I do not get into it with people regarding what is easy or hard, regarding, hey, is it easy to apply online? Is it difficult? How, should I be worried? I can't answer that. I don't know what those terms mean for you. From a time frame perspective, of course, applying online is going to far exceed whenever you could do anything, in person. You can apply online. I just want to quote, I want to make sure I'm right. I think I am. Okay. You can apply online for benefits, retirement, spousal, disability, Medicare, every single day of the year. Christmas, New Year's, Super Bowl Sunday, Rosh Hashanah, Yom Kippur, the day of the Cavs championship parade coming up soon. All right, Darius Garland, we'll see what happens. Monday through Friday, you can apply online as early as 5 a.m. to 1 a.m. On Saturdays, it's 5 a.m. to 11 p.m. Sundays, it is 8 a.m. to 11:30 p.m. My parents both applied online for benefits. And the funny thing is, I was out all day for presentations, so my parents were kind enough to watch our kids. My wife's out of town for work. Son is 13 and daughter's 11. They're fine, but I was going to be gone for 12 hours, and I know they would have driven each other crazy. So my parents stepped up, fed them pizza, took them swimming. I was actually a little bit jealous. So I was telling my parents to say, hey, look, when I talk about online services, I mentioned you guys because they both decided that was in their best interest. My dad's a couple years older than mom. He applied online when he hit 66. That's his full retirement age. A couple years later, when mom turned 66, she applied online as well. Now, in fairness, they were both their full retirement age, so their wages didn't matter. There was only one marriage for them both to each other. They don't have any minor children, and my parents don't have any disabled adult children either. So for them, it worked best. My parents did not want to go into an office. They didn't want to interact over the phone. That was in their best interest. You like my parents, may have laptops, may have decent Wi-Fi at home. Some of you still may have a VCR that's flashing 12. If that's you, call us. You still have a home phone attached to the wall in your kitchen, 1-800-772-1213. That's our national toll-free number. It allows you to talk to somebody between 8 a.m. and 7 p.m. Monday through Friday. Our office is reopened for face-to-face interaction back in early April. I think it was April 7th. Whichever day was a Thursday. I got to be honest, I can't. It was either the 7th or the 9th. I want to say it was the 7th. So you can walk into the local office if you need to. Our local offices are open Monday through Friday, 9 a.m. to 4 p.m. We are closed on the weekends. We are closed on the 11 federal holidays. I know some people may not be watching this in real time on June 16th, but we're going to be closed in 4 days. Was that the 20th for Juneteenth? So just be aware that there are 11 federal holidays in which the agency is closed for business. A couple of things regarding our offices. Number one, as of now, you still have to wear a mask when you visit our office, regardless of your vaccination status. A mask can be provided for you if you don't have one. Number two, we do have sort of social and physical distancing procedures in place, meaning there's a certain number of people we can have in the office at a given time. Let's just say it's 10 in a particular office, but let's say you're number 11. You're going to have to wait until someone leaves to be able to come in, and that means you have to take into consideration sort of weather-related issues. It's Northeast Ohio. According to my watch, it's 90 degrees now. It could be 59 tomorrow. You never know, but you just please be prepared for that. You won't be able to sort of wait inside. You'll have to wait in your car or outside. The third thing is we are really asking that if possible, you come by yourself to sort of keep the numbers low, but we understand some people may have mobility related issues. So if that's the case, just come with one other adult. The limitation doesn't apply to children, but the days of I'm going to go in with my friend and my cousin and my CPA and my financial planner, we just can't accommodate currently that many people. So we really would want you to come in by yourself or with just one other person if possible. Next slide, please. This is our website, socialsecurity.gov. You see that adorable little girl sitting on either her father or grandfather, I don't know, shoulders. You click on there, you can apply for retirement benefits or spousal benefits. We have disability link. You can apply for Medicare. All of our fact sheets and brochures can be found on our website. You'll see towards the left-hand side underneath that couple that's looking lovingly at their laptop, that's the link that'll take you to the My Social Security page. If English isn't your native language, you'll see at the top where it says languages with a globe. You click on that globe, it'll take you to the multi-language gateway where you can get information in a multitude of different languages. Next slide, please. Survivor benefits. At this point, someone has unfortunately passed away. For the children, the criteria is the same as it would be if you were still alive. So if you're no longer with us, your children may potentially be eligible for benefits if they are under the age of 18, 19, but still a full-time student in high school, not college. Or the children could be of any age as long as they were disabled before they turned 22. As far as the widow or widower is concerned, that person, once again, gender neutral, can potentially be eligible for benefits if they are at least 60 years old, 50 and disabled, or at any age if you and your late spouse have children that are under the age of 16 or children that are disabled before turning 22. 3 things to be aware of when it comes to survivor benefits. Number 1, you can be remarried to someone else. And I don't know why I smiled, but you could be remarried to someone else and qualify for benefits as long as your new marriage took place after you turned 60 or 50 if you're disabled. Second, you can be divorced from the late worker and qualify for benefits as long as you're married for 10 consecutive years. Then you got divorced. Then they passed away. It would be tough to do that the other way around. Finally, if the marriage ended because of that person's passing, in most instances, the duration of marriage is at least 9 months. However, if because of the laws of your particular state, you were unable to get married prior to 9 months before the passing of your spouse, we may be able to pay you even if you weren't married for 9 months prior to their death. Next slide, please. Now, here's where semantics kind of matters. See, if you have lost your spouse and you are at your full retirement age, you could potentially be eligible for 100% of the benefit amount that they're receiving, assuming that you're getting less money. My go-to example is a couple that I call Dave and Jane. I know a Dave, a good buddy of mine. I don't know any Janes, but I digress. So Dave and Jane both work, both paid into Social Security. Dave's getting $1,800 in retirement benefits. Jane's getting $2,000 a month in retirement benefits. So every month we're paying that household $3,800. I had to stop and do that math in my head real quick. So fast forward a couple of decades, let's say they're both in their mid to late 80s. And let's say Jane unfortunately passes away first. Her $2,000 is going to stop. We can't pay her anymore. She's no longer alive. But since her now surviving spouse was getting less money, he can apply for survivor benefits to bump up his benefit amount to the $2,000 amount that she was receiving. So now Dave is getting a benefit amount equal to that of his now late wife, but the household's getting less money. Well, let's flip the reverse real quick. Once again, Jane's getting $2,000, Dave's getting $1,800. Let's say Dave passes away first. There's no additional benefit to pay Jane because she's already getting a larger benefit amount. Now, you may say to yourself, well, Brandon, why are you explaining this? That's really elementary. Not for everybody. And some people may think that when we say, oh, you're going to get your late spouse's benefit, they may think that means I'm going to continue to get my current benefit plus their full check on top of mine. And that isn't how it works. If you are getting a larger amount from Social Security than that of your now late spouse, there is no additional benefit to pay you. If you're 60 years old or 50 and disabled, or just if you're younger than your full retirement age, there's a reduction in the survivor benefit because of your age. So at 60, it can be as little as 71.5%. But every month that you could wait, it could creep up to the 100% rate. So if you're 60 years old and your late spouse was getting $1,000, that means you're eligible for about $715. And the only way that you could get a larger amount is by waiting until you're older, because the survivor benefit is going to be based on the work record of the now deceased employee, and the age of the applicant, you as the surviving spouse. Now, you can switch from retirement to survivor or survivor to retirement if the second benefit is going to pay you more money. So let's say you're getting a $900 retirement check, and a couple years later you become eligible for a $1,900 survivor check. Or let's say you're getting a $900 survivor benefit, and fast forward a couple years, you're eligible for more money on someone else's record or a different record. It's possible to switch. You just can't switch back. So you can't go from retirement to survivor, then back to retirement to get more money. Once you switch, you have switched. Next slide, please. In my 19-year career, I don't recall ever seeing an application for parents' benefits. You are the parent and you're at least 62. One of your adult children has passed away, but before their passing, they were providing at least half of your support. So you are a parent receiving Social Security because of the work record of your now late adult child. Last but not least, there's the lump sum death payment. It is a one-time check of $255 that can be paid in some cases to the surviving spouse or dependent children. Next slide, please. Everything I've talked about so far, except for the lump sum death payment, but retirement, survivor, spousal, ex-spousal, parents, children, every monthly benefit I've talked about so far, there's a limit to how much you can work and earn and receive benefits. It's going to depend on how old you are this year. So if right now, if you're already 66 and 4 months old, or if you're going to be 66 and 4 months old, sometime later on this month or through July 1st, we already consider you to be at your full retirement age, and you can make whatever you want to. 10,000, 20,000, a million, a billion, you're good to go. Now, let's say you're not going to reach your full retirement age at all this calendar year. Then the limit, if you were going to work the entire year, is $19,560. Can I make more than that and collect benefits? Sure, but for every $2 you make above that limit, we'd have to hold back $1 in benefits. So for example, if you're going to make, say, $23,560, that's $4,000 over the limit. So we'd have to hold back the first $2,000 in benefits that we could pay you in 2022. That amount is gross earned wages as an employee or net profits from self-employment. Money that you get from stocks, bonds, CDs, IRAs, mutual funds, pension plans, lottery winnings, annuities, inheritances, a good couple of hours at the church bingo hall are not an issue for us. What is your job paying you? What are the profits from your own business? Finally, if you're going to reach your full retirement age this year, meaning if you were born in 1956, you're turning 66 this year, add 4 months to that, as long as it's still in the calendar year, you're going to reach your full retirement age in 2022. If that's the case, we only care about how much money you're going to make in the months before you reach that age, and that limit is $51,960. So, for example, let's say your birthday was in April. In April, you turned 66. Well, add 4 more months to that. That's August. That means as of August 1st, you're at your full retirement age. We only care about how much money you're going to make through the end of July, the months this year before you reach that age. And if you wanted to conceivably start collecting your benefits now, as long as you're not going to make more than $51,960 through the end of July, we can start paying your checks now. Now, would starting to collect your benefit in June versus August make a difference? I mean, it would be a slightly smaller check. Instead of getting 100% with August, maybe you're getting 99.2% now, 98.8%. There's going to be a slight reduction if you take it early. As I mentioned in the beginning, when I was running through my spiel, take these with a grain of salt. These numbers were different last year. I can't remember what they were. They may be different next year. We'll find out what they are in October. Next slide, please. All right. So I just threw a lot at you, and I fully understand that. But let me just sort of pull back real quick and just kind of quickly recap before we jump into Medicare. Ultimately, for most people, the main decision when it comes to Social Security is when. When on that timeline of your life do you feel it's appropriate for you to take your benefit? As far as Social Security is concerned, there is no right time. Take it early, take it late. Please do whatever you feel is in your best interest. For most of us, our eligibility, it just sort of happened. You know, whatever, if you believe in any higher power or deity, they allowed you to continue to wake up to get close to benefit eligibility. You had worked long enough, but for most people, you're not working specifically for Social Security eligibility. You're working to put a roof over your head, food on the table, clothes on your back. And once again, I don't know about any couple, but you're probably not married specifically to make sure that you're eligible for Social Security. I don't know, but who knows? But what I'm saying is, for a lot of us, it just sort of happened. You know, you blink and it's like, oh, shoot, I'm eligible for Social Security. I mean, I'm 47 years old. I don't have the age yet, but I've got my 40 credits and, you know, knock on wood, if I, you know, am able to see my 60s, I'll be eligible for benefits. It wasn't something I actively strided. It's not something I tried to do. It just happened. So, you know, but once the dust settles with all that, if you're old enough, if you work long enough, if you were married long enough, you're eligible, we can pay you, but you got to decide the when. And the thing about Social Security is, you've seen, the longer you wait, the larger the check is. So if you woke up tomorrow, happy birthday, and you turn 70, well, guess what? We're going to pay you more money than we could have a year ago, 2 years ago, 5 years ago. Medicare's different. With Medicare, you have more clearly defined windows of when you potentially could or should do something. See, if you woke up tomorrow and you're 70 and you realize that you should have been on Medicare 5 years ago, you're going to have to pay more money out of your pocket. So you just want to, once again, I am not trying to elicit any specific emotional response from people, but I need you to sort of just kind of understand just the basic framework. So real quick, what is Medicare? Medicare is federal health insurance for people that are aged with certain disabilities. To qualify for Medicare, you got to be 65 years old or older, unless you've been receiving Social Security disability benefits for 2 years. You have amyotrophic lateral sclerosis, much better known and much easier to say as ALS or Lou Gehrig's disease. If you have end-stage renal disease, kidney failure, or if you live in Libby, Montana, and you're exposed to asbestos. I know that the BBB of Greater Cleveland has an extraordinary amount of reach and cachet. I don't know if anybody on here is living in Montana, though. So I'm going to say that you're probably not from Libby, Montana. All my jokes and quips aside, I certainly do hope that your kidneys are fine, that you don't have ALS, and that you're not on Social Security disability. So for most of you, 65 is when you need to be sort of aware of what's going on with Medicare. Next slide. Before I go any further, let me give you 2 phone numbers and 2 websites right now. Plus, I'm fully hydrated now. It's hot outside. You got to keep up the electrolytes and your, I don't know what else. It's water, but I'm sure in my mind there's some electrolytes. So Medicare and Social Security are not the same. There are no Medicare offices. Right? If there were, they would probably be really packed, but there are no offices. So if you need to contact Medicare, or if you want to be able to get really reliable Medicare information, here are the 2 entities you want to contact. The first is you can just contact Medicare directly. Their phone number is 1-800-633-4227. That's 1-800-633-4227. Their website, it's really difficult. It's medicare.gov. medicare.gov. There's another organization. It's based out of Columbus. It is part of the Ohio Department of Insurance. They do a bang-up job of informing Ohioans about Medicare. I had the pleasure of working with one of their professionals on Tuesday when I was in Berea for a presentation. The name of this organization is OSHIP. That's SHIP with a P. OSHIP. IIP. What does that stand for? Ohio Senior Health Insurance Information Program. OSHIP allows you to get free, accurate, concise Medicare information. If your community has an office on aging or a senior center, they probably have OSHIP trained volunteers or employees. OSHIP does webinars. Hey, they do welcome to Medicare events. During the fall, they do Medicare checkup events in all 88 counties. I would call them if you have Medicare questions or you just want some basic information. Their phone number is 1-800-686-1578. That's 1-800-686-1578. The website, insurance.ohio.gov. Insurance.ohio.gov. All right. So, don't I get Medicare automatically? Don't I just have to go outside and go to my mailbox and the car is just going to be there magically at 65? No. You are not automatically enrolled in Medicare unless you're receiving Social Security benefits prior to 65, or if you're on it after 65, then you there's no way to get off of Part A. But long story short, you're not automatically enrolled unless you're already receiving benefits from Social Security or have applied for benefits. So, if you're sitting there and you're approaching 65, you're still working, or maybe you're not working, but you're not on Social Security, no, you will not automatically be enrolled in Medicare. So in that instance, you would have 3 non-overlapping windows to sign up for Medicare. The first opportunity you'd have is called the initial enrollment period. It is a 7-month window. It's the month of 65 plus the 3 months before and the 3 months after. So if you don't mind quickly indulging me, if you got a piece of paper and a pen or pencil or crayon or marker, just what's your birthday? I don't need it, but just for yourself, jot down your birthday. Your month. Add and subtract 3 months from that. Those 7 months now on your piece of paper. I mean, that unless you write really fast, you didn't have a chance to write them all down yet. But you get what I'm saying. Those 7 months, that's your initial enrollment period. Unless your birthday is the first day of the month. If your birthday is the first day of the month, you have to shift everything up by a month. So, for example, if your birthday is May 1st, we actually consider you to be 65 on April 30th. So April would be your age 65 month. So your initial enrollment period would go January through July. January, February, March, April, continuing June, July. May, June, July. Sorry about that. But let's say your birthday was May 2nd. In that case, your initial enrollment period would be February through August. February, March, April, May, June, July, August. So once again, let's make it real simple. When is your birthday? If it's not on the 1st, write your birthday month, add and subtract 3 months. If your birthday is on the 1st, put the month before you were born down and then add and subtract 3 months from that. And those 7 months are your initial enrollment period. Now, let's say you're still working, you're still covered based on your job's healthcare plan as a current employee. Or let's say your spouse is still working and you're covered under their current employment-based healthcare plan. If that's the case, you can be granted, in some instances, a special enrollment period. Special enrollment period allows you to delay signing up for both parts of Medicare until you're no longer going to be covered by that current employment-based healthcare plan. Retiree coverage doesn't count. COBRA doesn't count. The way the special enrollment period works is it gives you up to 8 months following the month in which you lost that healthcare coverage to potentially sign up for Medicare with no gap in the coverage or no increased premiums. The special enrollment period can only start until you are at least 65 and 4 months old. I usually suggest, though, if you're still working or if you have healthcare coverage at 65, you may want to just contact them just to see what, if any, expectation they have of you. Some jobs, they'll cover you. They don't care if you're on A or B. Some jobs may want you to sign up for just Medicare Part A. Maybe you're working for a small mom and pop, or you're working for yourself where you need to sign up for both A and B. Once again, it depends on your individual situation. Finally, there is an annual open enrollment period for someone who didn't sign up under the initial or the special enrollment period. Let's say I'm 65 today. I moisturize, so I still look relatively youthful. But I'm not working, I'm not covered, I'm not married, I have no employment-based coverage. But I don't want Medicare. I'm drinking my electrolytes. I'm on, got CBD oils. I'm good. I'm good. Fast forward 2 years. I'm not so good. So now at 67 and mid-June, maybe I do want to sign up for Medicare. Well, if I'm 67, the initial enrollment period is out. There's no special enrollment period for me in this example because I wasn't working and covered through my job's healthcare plan or a spouse's job's healthcare plan. So I'd be subject to the general enrollment period. But that's the first 3 months of every calendar year. So if it's June, I got to wait until January. Sign up in January, the coverage would kick in February. And for every year that's gone by that I could have been on Medicare but wasn't, there's a 10% increase to my Medicare Part B monthly premium, and I will pay that increased premium for the rest of my life. Next slide, please. Original Medicare through the federal government is Medicare A and B. Part A is your hospital insurance. Part B is your outpatient doctor services portion of Medicare. For most people, there's no monthly out-of-pocket cost for Medicare Part A. There is a deductible. This year's $1,556. For Medicare Part B, there is a deductible. It's $233, and there is a monthly premium. The base price this year is $170.10 per month per person. That'll come out of your check before you receive it. Now, once again, you guys all know about deductibles and premiums. If you don't use it, you're not paying the deductible. But with Part B, if you're on it, whether you use it or not, you're going to be paying the premium. So, for example, this is my cell phone. If I turned it off and stuck it in a drawer, guess what? My cell phone provider is still going to bill me. Doesn't matter if I use it or not, they provided the service, so they're going to want their money. Same thing with Part B. Whether you use it or not, if you're on it, you're going to be paying. Original Medicare was never meant to be your sole source of medical insurance, so for some people, they're going to need some other coverage. They may need a secondary provider. That could be a Medicare supplement plan, could be group health insurance from their former job in the guise of retiree coverage, or it might be Medicaid. Then there's something called a Medicare Advantage plan. A Medicare Advantage plan is not a supplement to Medicare. It is a private company contract with the government to be your Medicare provider. So when, let's say there was a Brandon Smith Medicare Advantage plan, there isn't, there should be. With that plan, you don't need secondary coverage, and you probably don't need drug coverage because it's all in one. Finally, there's Medicare Part D, D for drugs. Private companies contract with Medicare to provide drug coverage. So think of it as you're driving down the street or you're riding down the street and you get to a fork in the road. One side is original Medicare A and B with probably a secondary provider and maybe a drug plan, while the other direction is just a Medicare Advantage plan. What's the best option for me? It depends. Depends on where you live. It depends on the drugs you're taking. It depends on what your physicians accept. Once again, Medicare and OSHIP are the best sources to sort of see what plans work best for you in your situation. Next slide, please. Almost done. Real quick, some of you have been told, or you've heard, you've maybe even read that you're supposed to sign up for Medicare 3 months before you turn 65. That isn't technically true. It's if you need the coverage to start at 65, you need to sign up in one of the 3 months before. I'll use myself as an example. My birthday is in May. That's why I used it as an example earlier. So, and it is not the first. So for me, decades from now, when I turn 65, assuming I'm not working, blah, 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 and I need to sign up, my initial enrollment period, once again, goes February through August. If I sign up in February or March or April, the coverage kicks in May, the month I turn 65. If I wait until the month of 65 to sign up, my Medicare Part B will kick in 1 month later. If I wait until 1 month after 65 to sign up, my Part B will kick in 2 months later. And if I sign up for Medicare 2 or 3 months after 65, my Part B enrollment will start 3 months after I signed up. So using actual months. Once again, this is just in my example, for someone that is born in May, but not on May 1st, if I sign up in February or March or April, the coverage kicks in May. If I sign up in May, the coverage kicks in June. If I sign up in June, the coverage kicks in August. If I sign up in July, my Part B won't start until October. And if I sign up in August, my Part B will not start until November. Next, and I think final slide, please. Oh, maybe that was it. Oh, real quick. You know what? In my mind, it was another slide, or maybe it was something else. So last thing I want to say before we open it up, and I still see this a lot online, and I'm sure the BBB talks about this as well. We do not cold call and threaten individuals. There's no such thing as canceling or suspending your social security number. If you get one of those calls, please hang up, block the number. Do not give them any personal information, not give them any financial information. That isn't us. We're not a law enforcement agency. Remember, we've all seen Law and Order. I have never seen Ice-T call somebody and say, hey, look, you're about to be arrested, but go get big box store gift cards and we'll take care of you. It doesn't work like that. So I know you're sitting there and you're minding your business and the phone rings like, what the heck is this? Just pull back. We've all paid taxes at some point to various agencies. I won't speak of them in public. How did you pay them? It wasn't big box store gift cards. It wasn't cryptocurrency. I don't even know what a Dogecoin is. It wasn't, wire transfers. So if you will send you mailed correspondence. And the final thing about all that is, in the before times, I was at a meeting with the Cuyahoga County Scam Squad, and I distinctly remember them saying, don't engage with these people on the phone because, one, this is all they do, and you're more likely to slip up and give them some information. We all have that smart alecky uncle who wants to say, I'm going to fudge around with them. Dude, you're going to slip up. Or two, they're just going to call you more because now they have a live body who's willing to engage with them. For the second time in this presentation, I'm jumping off my soapbox. I appreciate you listening to my nonsensical ramblings for the last hour or so. Any questions, concerns before we all skedaddle?
No, we just have some feedback that this was great information.
Oh,
Thank you. And I just want to say, if anyone does know anyone who might have a scam against Social Security, who they think who is impersonating Social Security, let me say, you can always report those to bbb.org/scam tracker. We collect all that information, and it helps people like Brandon and I be able to spread that information to everyone so that we can stop these scammers and impersonators from taking advantage of us.
And to Pamela's point, be careful with your Social Security card as well. You're all adults. You're going to do whatever's in your best interest. But we do tell people, if possible, there's no reason for you to carry it with you on a day-to-day basis. Here's what happens. You lose your purse, your wallet, your satchel, whatever. You had your ID, you had your Social Security card. What does the BMV want? Proof of your Social Security number. Excuse me, what does Social Security want? Proof of your ID. So if you have these two documents and I need each one of them to get the other one, I don't want to carry them both with me at the same time. We would just suggest and we know some people are transient, your life situation may be different, but if you have a safe place to hold on to your stuff, keep your Social Security card with your birth certificate, your marriage certificate, your DD-214, your passport, if you have one, in a safe place. So, safe deposit box, fireproof safe, down in the basement where the millipedes are and you don't like to go down there, just don't carry it with you at all times. I hope you don't have millipede. Those suckers are fast.
That's great, Brandon. It doesn't look like we have any questions. Again, this session was recorded, so it will be posted online. If you have any questions, you can reach out to me, and I can try to get those answered to you through Brandon. But he gave you all his office information. So I want to thank everyone for coming, and thank you so much, Brandon. You give great examples and make this very easy to digest. So we really appreciate it.
Greatly appreciate it. It's always been fun working with you guys. Always good seeing you guys. So give my best, everybody, at the BBB. And like I said, if there's any need or interest, maybe we can do this again. Maybe one day in person. Maybe you guys will feed me lunch. Who knows? Hope springs eternal.
Thank you, everyone. You have a great day.